Welcome to this week's Milton Keynes Council COVID-19 update. In the last 2 weeks, 4,376 people have been tested in Milton Keynes, and of those, 44 have been found to be positive with COVID-19. The number of cases in Milton Keynes is currently 5.9 per 100,000. That compares to 9.9 in Luton, 15 in Bedford, and 7.3 per 100,000 in Central Bedfordshire. These figures are different to the daily figures you may see published. The main reason for this is that testing results don't always match the proper period correctly. The data we get is reviewed and analysed to make sure it is correct. The figure I give you here on a weekly basis is the only one all agencies use when planning our response. The number is lower than last week, and this is a positive step forward. I'd like to say thank you to all those making a huge effort to keep each other safe. While overall our numbers are low, we have had 3 times as many cases in August than we did in July. More people are catching COVID-19, and the increase is not due to an increase in testing, which remains broadly the same. The virus remains highly contagious, and there is no immunity. It is only being prevented from spreading rapidly again because the virus prevention measures are in place and people are following the rules. It is really vital, as we head into the autumn and winter, that we continue all the effort we've made so far. It is tiring and difficult, and we all want it to go away now. However, it is not going to. If we want to keep slowly reopening our economy and slowly getting back to normal, we all need to work together to keep things moving forward. And I'd like to highlight a few areas that will be doing really important things in the next few weeks. Schools are now starting to reopen for all pupils. Central government have said that all children must return to school unless they have symptoms or have been told to isolate. I'd like to thank head teachers and staff in Milton Keynes for their hard work in making this happen. The way each school will work will be different to each school, so please take time to get to know what they are. Milton Keynes Council has been working with and offering advice to all settings, so you can be confident that staff and pupils are returning to environments that meet all the proper requirements. Colleagues in the NHS are also working hard to get as many of their normal services back up and running as they can. It is really important that if you feel ill or have health concerns, that you still get in touch with your GP or seek medical advice, even if they are not related to COVID-19. Keeping the COVID-19 rate low is vital to ensuring the NHS can return to normal treatment levels for people with cancer and other conditions. It's one really important reason to keep following the COVID-19 prevention measures. We are also seeing more people being urged to return to the workplace. It is important that we all try and support business to sustain our economy, to protect jobs and create new employment. However, it must be done safely and not put people at risk. It really is a balance between keeping things moving but avoiding the devastating impact an increase in infections and a second lockdown would have. We recently set up an email address for anyone worried about places where COVID-19 rules are not being followed. More than 70 people have so far told us about all their experiences at work or while out and about. We are now actively investigating a few cases where a pattern has emerged so we can put things right. You can email us at covidconcern@milton-keynes.gov.uk if you have any issues. Last week, I told you about setting up some local testing centres. Progress is being made and several locations are now waiting with national agencies for approval. We have done really well recently in getting that rate down, and following simple rules will keep doing that and keep us going in the right direction. Wear a mask in most public places, such as in shops and on public transport. Stay 2 metres apart from people if you can. Wash your hands on a regular basis. If you have symptoms, stay home and get tested. You must self-isolate for 10 days from the start of your symptoms, the date of your positive test, or if you're asked to do so, by test and trace. Until next week, please stay safe, thank you, and goodbye.